Thank you, Dr. Bolognini, for this wonderful presentation. We have time now to open it up for question and answers for Dr. Bolognini. Professor Gallo?
Yes, thank you very much for this talk, which was very empathetic as well, I felt, to the audience. And I had two questions, maybe they're related. I was very struck by something you mentioned almost in passing in the beginning, which was the idea that empathy is not always mobilized for positive or worthwhile or empathetic causes. And you gave the example of the mafioso who has to have an empathetic understanding and almost identification with the victim in order to destroy the victim or to hurt the victim later. And I was wondering if you could say a little bit more about that, because I thought there was something that perhaps relates to the last case study that you presented. And then the other question, which is related, I was wondering if you could say a few words about the opposite of empathy, which would be apathy, and the role that it could play in the psychoanalytic frame. And I also think perhaps it's related to the last analytic vignette that you presented.
Thank you for these questions. 2 hours ago, I was in my hotel room watching a television, and there was a wonderful documentary on wildlife in Africa. And particularly, it was on the skill of the guepard to select the victim, basing on a complex working through of perceptions regarding the state, conditions, energy, vitality of the different gazelle, and the final choice extremely precise regarding the easiest target of his attack. Unfortunately for the gazelle, the guepard had been absolutely empathic. We are speaking not about a psychoanalytic empathy that should be devoted to help people not to devour them, but it's an example of the many phases of the capacity to identify, to resonate, to utilize data in a complex way. Here, for sure, Gallese, Rizzolatti, and the Parma team could have had essayed about the specific guepard capacity. But of course, if we go to the human level, we deal with a much more complex perception of the many parts of the human beings, and the analysts, the contemporary analysts, in my view, are more and more specialized in contacting, perceiving, representing in their mind the many parts of a human being, including, if you want, the ego, how it works at the different conscious and unconscious or preconscious levels, the defenses, but also the state of the self, the libidinal budget of the person, the narcissistic condition, if the narcissistic capital of the person is poor or rich, if the consequent cohesion is there or is not there, and so on. We have learned a lot in this century from different authors about the many conditions, parts, factors which are in the human mental life. And regarding the second part of the question was about apathy. Oh, exactly. In the pathological sense, of course, this sort of anesthesia makes all human beings poor. So we are enemy of apathy. Of course, we put the patient in condition to contact the pain, because this cancels also the anesthesia, and they will be able also to experience love, joy, and many other, all the colors of the human sensitivity. But in June, I will go to Paris for a debate with a very famous colleague, Laurence Kahn, who wrote a book on the apathic analyst, with some slightly polemical attitude regarding the empathy, the possible empathy of the analyst. And I know where the issue is and where we can convene easily. It is a German word that Freud utilized, which is indifference. Indifference doesn't mean apathy. It means the capacity to suspend, to wait for, to keep oneself in a condition which doesn't adhere immediately to one part of the patient. I like to represent this like in those television screens where today is possible to open different windows and to keep in the screen several programs. And you can see, for instance, the same subject from right or from left, from upstairs or from downstairs. In this screen, which in my view is comparable to the analytic mind, the object can be represented in different ways and from different perspectives. This, in my view, shows a difference between a well-trained analyst and a normal, also if sensible person, sensitive person, because the analyst is able to keep him or herself in a partial indifference, which is not apathy, is the capacity to keep an observative point of view at multi-level way.
Thank you very much for your presentation, but I have one very interesting question for me after your presentation. I'm the psychiatrist also. And we have a huge discussion about the mirroring neurons now in the psychiatric field. And from this discussion comes my question. If we understand the mirroring system, that is the recognition of the motivation from the coming from mirroring system to the another person, and that is active also in not only by the people but in the mammal and so on. But if we speak about the recognition of motivation, and you make the parallels to the empathy, I would like to ask you if that is not the difference between the recognition of motivation and understanding of the states of the art of the inner world, because there are two different states in recognition. The first one, the recognition of the motivation, there needs the interpretation and the understanding of the states of the art of my soul, of the soul of another people. They do not need the interpretation. Then they need maybe somewhat different from that. What is your meaning about? That it is not the same. I would like to, for me, that is not the same, the recognition of motivation and to understanding of states of the art.
I would, yes, thank you. I would say that understanding the motivation is something that very frequently cannot be communicate to the patient if the patient is not in the condition to utilize such a communication, because the risk is to inform the patient about his or her motivation. If you inform someone, you are speaking with a sort of cortical conscious ego, and you are not contacting the underlying or connected or possibly connected parts of the person. Technically, we could demonstrate to a patient on the basis of his associations that he is thinking of something or is motivated to something, and this could be evident through the connections we can create in the material. And this is a very important level. It's what we could name as working with the ego. The ego of the analyst is speaking to the ego of the patient, which is a respectable activity. But is not but this is not real deep psychoanalysis, because also the other levels, the experiential ones, need to be contacted and included in the analytical exchange and experience. This is a much more difficult work, and usually it implies a longer time, what I call cohabitation with the patient. My example for better clarifying this situation is to imagine a person on the sand of a beach, a person who never entered the water in her life or in his life. This person can go into the water assisted by someone who is more familiar with that element. The first difficulty for this person, please compare all these steps to the analytic or psychotherapeutic situation. The first difficulty is to lie on the surface of the water playing the dead person. You know that if you lie as a dead person, you will have two undesirable effects at the beginning. One is that your ears will go under the water. And the second is that the central part of the body will go up. And an inexperienced person immediately gets scared of this. So someone has to help the patient to relax. You will not go down. You will feel your ears go down, but you will stay there. If this person learns to swim, it will be a big achievement if this person, that is the patient, will be able also to go 1 or 2 or 3 meters under the surface. We are now contacting the pre-conscious level. And the person, these 3 meters downstairs, will experience the water, the temperature of the water, can see the ground if you are close to the beach, can experience the balancement or unbalancement in this free-floating situation. But if you make a further step, you go into a submarine, the famous Picard submarine, which explored the Marianne Hole for 14,000 meters downstairs. You will see huge, profound areas, really corresponding to the deep unconscious. But you will see those through an oblong, a glass, a very big glass. You will not touch that reality. You will see. That is the equivalent of representing mentally, of a descriptive experience, not of a contact. So, in my view, the most fertile situation is the preconscious experience. And there you can really share with the patient and also describe with the patient at the ego level what the self is experiencing. Maybe I am detached from your question. I don't know exactly if we are in the area of what you were questioning about. But the motivation in itself is something that is important to know. But what is important is not to inform the patient about that only. If you inform only, we all are limiting the communication, like if we are describing from the beach something we can more or less see, or from the submarine. For this reason, I disagree with those analysts who are fond of giving stunning, astonishing interpretations which describe like an oracle, something the patient is detached from. One has to be in the preconscious area for really creating a new experience. Otherwise, it is like if I come to Vienna, and I look at the topographical card of Vienna, I can see, oh, here there is the Prater, here there is but this is an information. If I go to the Prater, I can experience it.
Thank you, Dr. Bolognini, for your wonderful lecture. I hope my English is good enough to make myself clear in my question. In 1959, Gabbard for the first time described a common ground emerging in the conception of the understanding of countertransference between the three main analytic schools. And you put the experiential level so much in the foreground of your paper and in the discussion, and also underlined that we are often taken by surprise about what is happening, that it cannot be planned. So is there really much differentiation between the emotional storm, like Bion describes it, or the Reverie, which also describes a kind of co-creation, and the thinking of an analytic third, like Britton puts it? For me, there seems not so much difference perhaps in practicing analysis, but perhaps in conceptualizing it. And I would like to hear if you can say something to this. I hope it was clear enough.
Oh, thank you.
Yeah.
I'm grateful for this mention about reverie, because the relationship between reverie and empathy is an interesting topic. I would start by saying that there are two risks, in my view, in contemporary psychoanalysis. One is the risk of empathism, which is the attitude to look for empathy. This attitude is stimulated by those authors who speak about empathy like a method. And the corresponding risk is reverism, because in my view, both empathy and reverie are privileged condition, privileged level of working of the analytic mind. And the risk of an excess of empathism or reverism, of emphasis basically on these two concepts, could lead, mainly the young analysts, to force their authentic, spontaneous experience during the session in order to create empathy or to create reverie. The same could be said to create co-creation I think all these conditions are privileged conditions that we can appreciate, we can study, we can better learn, we can understand how they are helpful, how much they are helpful in our work, but we have not to look for them, because otherwise we will lose a lot of reality in the difficulties, in the real exchange, in the real situation of the session. If I see, mentally speaking, that a person is there with open heart, or with a floating fantasy as an already established condition, a pre-condition, I become suspicious, because there is some defensive attitude or some fixed characterization of the analytic work. The analytic work is much more complex. If we reach a condition of reverie or of empathy or of co-creation, that's great. But this is not a method, in my view. Reverie implies, in fact, a working together, a dreaming together, associating together in a free-floating way, which is a step further the free-floating association, because it implies mainly a great freedom of fantasy. And the analyst in such case is experiencing the happy condition to be creative and to generate images, to recover memories, to connect different scenes. In my experience, this can happen when the patient allows us to do that. And the prototype, in my view, is the feeding situation of the mother and baby. Exactly like mother and baby experience, feeding is not at all something to be given for granted. We know that the mother is happy to feed and produces milk if the mouth and the desire of the baby stimulate her. And vice versa. The baby is happy to suck if the mother is really deeply desiring that, and so on. In many clinical situations, we can experience so different attitudes in ourselves and in the patient that we can easily reconstruct what happened at the beginning of the life of that patient. I had some patients whom the honeymoon experience was wonderful, and because they had already had that. And what is really surprising is that the analyst not only experiences a feeling of honeymoon, he or she really becomes more able to associate, more rich in its work, in his work. And it's something real. And the patients who have this good start will, of course, impact further difficulties, those difficulties which led them to us. For instance, Oedipal difficulties. I remember, it comes to my mind at this moment, a patient who had a wonderful honeymoon, and we were a wonderful couple. We produced a lot of associations, we were creative and so on. But 1 year after, when the Oedipus came up, the atmosphere changed completely, and we faced the real difficulties. With other patients today, we face the opposite. They are very difficult to start. The atmosphere is heavy, poor, absolutely contracted. And these patients need to be familiarized with the breast, with feeding, with intimacy, with closeness. And that is the job with them. The difficulty of many patients today to accept a high frequency in their treatment at the beginning is exactly due, in many cases, to this resistance to dependence. And the real analysis consists in allowing them progressively to go to a higher frequency of the sessions, exactly like a mother has to make a great work with the baby to familiarize him with the feeding process. When a disaster had happened at the beginning of their personal life. So we have today so many differences in so many differently organized patients, narcissistic patients, or depending patients, etc., etc. It's a complex work.
We can have one more question, I think, if anybody. No? Okay.
Thank you very much. I wonder whether you could say a little bit more about this point that you said at your presentation, but also now in response to these questions about empathy, or whether we call it reverie or even perhaps countertransference, is not a method. And so it's more like has something to do with the state of mind of the analyst, perhaps, or the Haltung, as we would say in German. And what would you think flows out of that as the implications in terms of the training for candidates, how to become psychoanalysts, how do they achieve to learn this state of mind or this Haltung when it's not about the method?
I would say that during the training we become more familiar with ourselves. And this gives us the opportunity to resonate to the other's condition in a corresponding way, because, as Greenson said, more or less nothing is in the patient that is not in ourselves. What changes is the size, the proportions of these parts, but really, like Terenzio, the Latin author, said, homo sum, nil humani, nothing human is far from me. So potentially we have a capacity for resonating. But our training should facilitate our contact with ourselves and consequently our resonance with the patients. Countertransference that has been evoked before has been a very dispute in psychoanalysis, because someone emphasizes it as a demonstration of the resistance in the analyst and in the patient. Someone else shows it as a tool, an instrument for working analytically. I think there is something true in both these aspects, because when I countertransferentially resisted in that glamorous way to Mr. Piero's pain in front of our separation, there was an evidence of a countertransferential defense and resistance between the two of us. But at the same time, countertransference is also the way we can resonate in many cases. And fortunately, the psychoanalyst explored very well this difficult area. For instance, the distinction between concordant countertransference and complementary countertransference was extremely helpful, because we understood how limiting our perception only to one of the two would be very strict, a very narrow perspective. Today we are widening our scope because through the concept of enactment that many people consider like the fourth via regia, after the dream, after the transference, after the counter-transference, also the enactment can give the opportunity, if it doesn't stop at the level of acting or something like that, but if it becomes something that the two, analyst and patient, can reconsider, can observe, can exchange and discuss, it becomes an extremely helpful tool for revising what happened. And we had so many wonderful authors in psychoanalysis that if we are not linked by a residual transference to only one of them, we will be able to utilize a wide range of tools. The issue is having or not analyzed our transference, not only to the analyst, not only to the supervisors, but also to the authors. Because there are some sacred dedications, devotions to some only one authors, which has nothing to do to preferring one author instead of another, but we have to recognize that many authors were able to describe very important realities in psychoanalysis. So this is a challenge for the future, to recognize this big family of analytic authors.
Thank you very much, Dr. Bolognini. Thank you, everyone.